It's another day with the physicians where your health is our business.
With growth spot the end. So you are not going to take some drastic measures. But a 10-year-old tummy, pressure is high. But also to know that it's not only when your pressure is high that you have glaucoma.
Sugar, and I don't know about any other one, but what you know is
You're welcome back to the Planet Ultra of your regular program. First thing you should know is that breastfeeding keeps your baby healthy. Breastfeeding is good for babies. There is no question about that. Exclusive breastfeeding is encouraged for its health benefits, such as protecting the baby against common childhood diseases. It protects against allergies, sickness, and obesity. Against diseases like diabetes and cancer. Against infections like ear infections. It is easily digested, no constipation, diarrhea, or stomach upset. Breastfeeding has lots of good sides, or rather, it has lots of advantages. More will be learned from our mother, a nursing mother, and a nurse. She's going to give us life experiences, how to breastfeed a child, a baby, and also from the nursing aspect, she's also going to talk to us more about that. Of course, where else can you get this if not from your regular program, The Physicians, where your health is our business. It's another day with The Physicians, where your health is our business. Today we'll be talking about a topic that is very, very close to my heart. Close to the hearts of mothers. And of course, some fathers too. We'll be talking about the importance of breast milk, the importance of breastfeeding to the child, to the mother, and of course to the family. My name is Dr. Martina Agbere, a regular host on this program. Of course, I'm not alone. I also have with me my very elegant, beautiful, ever smiling,
I remain Dr. Mimuna Yusuf Kadri. Welcome to your Physicians, where your health is our business.
Today we're talking about the importance of breastfeed.
Yes.
Of course, breast milk.
Yeah.
Right, mother? Breast milk. Exclusive breastfeeding.
I did it. Oh,
what is exclusive breastfeeding?
at least 6 months.
Of?
No milk, no water, breast milk. And it had huge benefits for me.
Me too. I don't know about other people, but I actually did practice exclusive breastfeeding. 6 good months.
No
water, nothing, just the breast milk and feeding on demand. Feeding on demand. So when I had to even resume work, I used to bring my child with
my
me.
baby was with me.
Always with me,
Yeah, it was exciting though.
Okay, there were some times, Lagos traffic. There was a guy was driving.
And the baby's
My baby was crying. Then I parked my car
to breastfeed.
to breastfeed on 3rd mainland.
Yeah, I've done that too.
Probably because we know the importance of breastfeeding.
I think so. I enjoyed it, and my babies all breastfed for a year plus. Aside from the exclusive of 6 months, I still saw the benefits. They were less visiting the pediatrician, less infection, and they were looking very robust and chubby.
Because these days, the young mothers really don't believe that they should really breastfeed exclusively.
Yeah.
So we need to do a lot of talking, a lot of advocacy.
Yeah. Some said it's their career. Some said it affects their.
Apart from the career, the beauty.
Yeah, they want to have snapback body.
But then they need to remember the importance to the child.
Very
child first.
important. Very important.
Well, let's not go.
We have an expert in the house.
We have an expert in the house. She's a nursing mother
and a nurse. So it's all in one.
We'll be back after this short break. Just stay tuned. Welcome to your regular Health Talk TV health show, The Physicians, where your health is our business. Today's topic is actually, like I said, something very close to my heart, the breast milk. And with me in the studio, we have a guest. She is a nursing mother and a nurse. So we're going to be hearing from her the advantages, the benefits of breastfeeding as a mother who is also working and as a nurse. I have with me in the studio Mrs. Miracle Ugwu. Welcome to our program.
Thank you.
You're welcome.
Looking
You look
good.
lovely.
Thank you.
Smiling.
Thank you.
Okay, we don't have much time. Let's go straight to, because this topic is very interesting and it's also, I don't know how we're going to cover it, but you have to just do that. Let's first of all tell us your experience as a mother and as a nurse on the importance of breast milk and breastfeeding.
Okay, I want to start with letting you know, one, the definition of breastfeeding. Breastfeeding simply is when you feed your infant breast milk. It can be directly through the breast or you express. So now, exclusive breastfeeding is when you feed your baby breast milk for the first 6 months without formula, without water, without juice. Now, I want to talk about my experience. I want to talk about my experience as a nursing mother. My baby is 4 months now. So breastfeeding, I see breastfeeding, exclusive breastfeeding as a personal decision. Something that you've already told yourself, see, no matter what, I want to breastfeed this baby exclusively. It gives this sense of achievement that, I think I've done what I'm supposed to do as a mother. Also, it can be challenging. Some people tend to draw the opinion from friends to know how they are coping with breastfeeding. Some people tend to draw the opinion of their family members to know how they did it, because it's not easy. You just have to be prepared. You have to tell yourself, see, I want to breastfeed this baby exclusively. There are a lot of night wakes. It's not easy. Family support is very important during this period. Like your husband, he's there for you. Your parents, sometimes mothers come in during the first month of childbirth. So I will tell you my experience. When I gave birth, that was February. It wasn't easy because I delivered by cesarean section. But anytime I'm pregnant, I've already have this mindset that my babies, I always want to breastfeed them exclusively because of the benefits. The benefits can never be understated. There are lots of benefits with exclusive breastfeeding. One, it contains a lot of antibodies that protects the baby from all these common childhood illnesses like pneumonia, getting bouts of diarrhea, some infections, and all of that.
I want you to take a step backward because I think something you are going to say is going to benefit a mother, even an inspiring, mother,
Okay.
including the fathers. Don't take that away from them. You said you had your baby via cesarean section.
Yes.
I know it comes with a lot of,
Pain.
pain, and some people don't tend to breastfeed because maybe there's not enough milk, or because of the pain, they don't give that first liquid gold to the baby. So I think we need to talk about that part so that somebody out there can pick from your own personal experience. Yeah.
Okay. Already I booked for a cesarean section. So the normal process, what's the name? The normal process of the childbirth, I already know that I'm going into the theater.
Yeah.
And I've already have this mindset. I told my mom, nobody should give my baby water.
Formula.
Nobody should give my baby formula. That when I regain my strength, I will initiate. Yes, I will initiate breastfeeding immediately. So though they will give you a lot of to relieve the pain, you'll be on analgesics and some other pain reliefs. So when I got myself, I saw my baby, I was happy. I had to initiate breastfeeding immediately. I was given a nursing pillow just to help support me. Yes. So at first the baby was sucking. At that point you can't measure the quantity or the amount of breast milk that the baby has taken. And there's this first breast milk that the baby receives. We call it colostrum.
Which is the liquid gold.
Yes, also known as liquid gold, is very, very, very important for babies. Why? One, it has immunoglobulins that protects baby from illnesses, diseases. Also, it has this laxative effect that helps them to pass meconium. Yes,
so that's
yes,
the first stroke.
yes. And also, in return of that, or being able to pass the meconium, it also helps them to excrete the bilirubin, which normally we know that causes neonatal jaundice. Yeah. So there are a lot of benefits. So I initiated within the 1 hour. I initiated how would I put it?
The process of breastfeeding.
Yes, the process of breastfeeding.
Regardless of the pain, you just told yourself you just have to do
that.
This.
Is actually
that's very brave of you.
Well, just hold on. We're going to talk more about your experiences, and we'll also share our experiences with you, so that everyone out there will be able to go with us and understand the importance of breastfeeding a baby. We'll be back after this short break. Just stay tuned.
A child nutrients.
It's the healthiest meal you can give to a baby for the first 6 months of life. So it protects the baby against so many diseases, so many infections, so many allergies.
The importance are enormous, from nutrition to fighting ailments to growth and stability for the child.
It gives nutrients to a child and makes the child healthy.
Things like not having postpartum depression, and things like helping the mother to lose weight.
4 or 5 months should be okay, because when it's more than a year, it will be very difficult for that child to stop breastfeeding.
The first 6 months of life.
The World Health Organization pegs it at 6 months. That's for exclusive.
I would just say that she can be, when she's in the office, she can be doing milk. And when she gets home, she can do the breastfeeding.
We have different breast pump, various products that you can buy and use to express the milk and keep.
Support, and lots of support.
Welcome back. If you're just joining us here onto your program, The Physicians, where your health is our business. And we'll be talking about the importance of breast milk and breastfeeding. And we just talked about the liquid gold. If you have never heard about the liquid gold, that is called the colostrum. The colostrum is the first milk that comes out of the breast when the mother wants to feed the baby. Some people call it a myth. Some people call it the devil's milk. Is it really the devil's milk? I tell you something, that milk is the most important that comes out for the baby because it has a lot of things, a lot of protective things in it for that baby. So if you discard that very first part of the milk called the colostrum that comes out, you have actually deprived your baby of some very, very important nutrients, antibodies. Please do not discard that. So let's go back to our guest. Let's hear more from her. Miracle, we're talking about the colostrum, which I just talked about now, but then you just shared your experiences as a mother. Now, as a nurse, well, we know that when you are initiating the breastfeeding, doesn't start at the process of just when the baby arrives. For mothers, when they come for antenatal, what is expected of them? What are they supposed to know to prepare them for breastfeeding? What do you do? What do you advise them?
Okay, first, during antenatal period, there are a lot of education they give to mothers concerning breastfeeding. One, the positioning, how they are to sit, the way they need to carry their baby, because a lot of people, the way you strain yourself
when you
slack that you want to breastfeed, yes, you need to sit upright. The head of the baby should be in straight line with the body, and the tip of the nose should be touching the breast, even the chin. So the positioning is very important, because if the woman is stressed, she won't be relaxed, and thereby reducing the let down of milk.
I love that word, the let down. That reminds me of the let down reflex.
Milk let down.
That is actually what propels the milk to actually come out.
Yes.
So now you're talking about positioning of the baby. The baby should be well positioned. Yes. In some cases, the women actually would cross their leg, or they put the pillow.
Yes, the nursing
to support the nursing pillow to support them. And there should be eye contact.
Yes.
Also, if I remember very well, there should be eye contact. The eye should be that
yes,
of with
bonding,
the baby.
Yes. Promotes bonding.
And of course, the areola. The areola is a black part of that breast. The whole areola should actually go into the baby's mouth so it latches properly.
Yes.
With that, it sends down the let down reflex. Okay? Yes. So mothers at antenatal are supposed to actually know that aspect also. Okay, how about the cracked nipple? What do you think is responsible?
A lot of things, like one, if you have perfumes that contain alcohol, or soap, detergent, you use detergent that contains alcohol, they can cause cracks. Yes, cracks at the nipple area. So what you need to do, you can apply some ointments on the nipple, and also you can allow the nipple, after breastfeeding, you can allow the nipple to air dry. Yes.
So now we talk about breastfeeding and the importance of breast milk, and sometimes it's not a fault of some mothers. They are not able to breastfeed because there's that inability to have enough breast milk for the babies. What could be leading, what can we say at this point in time, reasons why some cannot breastfeed and why they may not have enough breast milk for this month for their babies?
Okay, thank you. Some people tend to say they don't have enough or they don't produce a lot of milk, but the truth is that they've not measured to know if they can or if they are not, and also are they relaxed. You need to give the baby time to suckle. The more the baby suckles, the more you produce breast milk. So you need to give the baby time to suckle. And also, you need to measure. Some people can measure the amount of breast milk that they produce. They'll be like, because the baby is latching for a long time. Every baby is unique. Some people prefer a frequent
feeding on demand.
Yes, frequent, shorter feeding period. Some people prefer a longer feeding period. Some babies will latch 15 minutes, some 20, but the mother might just 5 minutes. Are you sure this baby is even getting anything? Though there are some illnesses that the baby will have that the baby will not latch well. If it's a preterm baby, the baby can't. The palates are not matured enough, so the baby can't kind of latch well. So you need to express and give the baby. Even the mother, there are some illnesses that the mother will have. The mother is advised not to breastfeed. Such as active untreated TB, even HIV positive. Though there are studies that said if a HIV patient wants to exclusively breastfeed, the person can do it just the first 6 months. After that, the person should stop. But if you are not feeding on demand, or like at night, you're supposed to, baby is crying, you need to breastfeed to help in the let down and more milk secretions, and you are not doing it. And also, if your viral load is high, you can also transmit the virus to the baby. So is it that you are exclusively breastfeeding the baby, or you don't do it at all? Also, those ones using illegal drugs, such as cocaine and all that, because most of those things can pass to the baby. Medications and some other things, they can pass to the baby. So those ones taking illegal drugs, it will affect the baby. Yes.
So as a nursing mother and who is also working, so how have you coped with practicing exclusive breastfeeding?
Work-life harmony.
Yes, it hasn't been easy, but I started preparing for this earlier before now. So I have loads of frozen breast milk in my freezer.
Wow.
Yes, because I know that this is what I want to do. That guilt. How will I do exclusive just for 4 months? Or just for 3 months? I need to just complete my the exclusive breastfeeding. It gives me this sense of achievement. I'll be like, I did it for the sister. Why can't I just finish up for the second born and all that? So I have a lot of frozen breast milk.
How long should that last?
6 months.
No, the frozen breast milk.
6 months. Yes, yes. Room temperature, it can take up to 6 to 8 hours. Wow. Then in the fridge, you can stay 3 days. 3 days.
You talked about frozen breast milk. That takes me back to something that happened. There's a colleague of mine, a friend, actually, who works in the bank, and she does exclusive breastfeeding. So she usually will lactate and put the feeding bottle that she'll use spoon to feed. So I'm just trying to tell you how the breast milk looks like. Usually very oily, and the mouth of the baby becomes oily. So this lady actually puts the breast milk in a glass, in a bottle, and put it in the fridge in the office. Do you know that the office people actually thought it was milk? They didn't know there was breast milk from somebody. Meanwhile, the baby was at the crèche. So what they did, the guy wanted to drink tea and took the breast milk and added. So the lady came and was, "Where's my breast milk?" She was looking for the breast milk. Why am I saying all this? That's to tell you how the breast milk looks in the bottle. It looks very nutritious, oily, and everything. So breast milk, you can't quantify the advantages. The baby's immune system is up. There's this bonding, there's this love. The eyes are bright blue, really, really clear.
We didn't actually talk about the importance to the mother.
Yes. Give us one or two things about the mother.
Yeah. One, as you said earlier, it promotes bonding, physical and emotional bonding between the baby and the mother. And also, it saves time. It saves money and is readily available. You don't need to buy formula, or you don't need to start sterilizing that you want to breastfeed. Just to make sure that the breast is clean, you wash your hands and you breastfeed. And also, it provides this natural family planning.
Yeah, yes, that is very key.
Yes, natural family planning. It is called lactational amenorrhea. Yes. So when you are feeding exclusively, it kind of delays menstruation and ovulation.
And let mothers also know that when you breastfeed exclusively, it also helps in reducing the size of your tummy.
Yes, because the womb goes up back to this
tummy, snatchback.
It has nothing to do with that tiny of the tummy.
No, that is a myth.
Okay, so thank you very much. For glad you actually made it, and you have put your voice to this. Breastfeeding is actually very important. Your baby's life is very important. The advantages can be quantified. Well, Memuna, last word.
Of course, we've all heard the importance of breast milk breastfeeding from our nursing mother, and of course a nurse, how she's doubling that as in work-life harmony and the numerous benefits to the baby and the mother. So if you're an aspiring mother out there or you're a mother right now, just know that exclusive breastfeeding is recommended for you with all the benefits that comes with it. I remain Dr. Memuna Yusuf Kadri, and please kindly follow us on all our various social media platforms, Facebook, Instagram, YouTube. And if you want to be a part of this program, we are just a click away. Till next time, stay blessed.
I'm Dr. Yetunde Ayoyalo. I'm the founder of Market Doctors, and I also take care of the elderly at home. I want you to continue watching the physicians because they give solid advice and issues that are pertinent to health in Nigeria. Keep watching the physicians.